Hi, this is Dr. Kolodenker, and we're going to discuss the sensitive topic of whether or not you need your toes. Typically, people that are asking this question are in a tough situation. So, hopefully, I can answer some questions for you and make you feel a little bit more at ease. Bottom line is no, you do not need your toes. You will be able to walk just fine. I've seen patients run just fine. Um, and life will go on. It'll be okay. There are silicone prosthetics that can be purchased to put over the foot, so that way, if you decide to go barefoot or in sandals, nobody will even know. There are custom inserts that can be made for your shoes. There are custom fillers that can be made for your shoes. So there are ways to deal with the situation. I've had patients who have had half their foot amputated and they're still able to do their daily activities. They're still able to go for walks. I've had patients who can run. I've had patients who still continue bowling even after they've had half their foot amputated. So it's not going to be something that slows you down for very long. You'll feel slightly imbalanced temporarily, but that sensation is going to pass. It's not going to linger on for too long. A little bit of therapy and just getting used to it will be just fine. The hardest thing is making that decision to go forward with the amputation, and that's where most patients seem to have the hardest time to just kind of I'm not sure if it feels like you're giving up, but it's difficult to say, yes, take an appendage of mine, take my foot, take my leg. So they're definitely not easy decisions. I will tell you that if you are sitting there and talking to your doctor about planning a decision like that, you are at an advantage versus somebody who has a very bad infection and there's really no option but to have an amputation. In my clinic, we try to do everything we can to salvage, of course, to heal wounds, to prevent amputations. But I wish I could say that we were 100% successful, but that would not be true. Some patients end up getting amputations, and that's the unfortunate reality of different diseases like diabetes and vascular disease and poor blood flow, kidney failures, those kinds of things. Patients that are healthier, that have undergone trauma, tend to heal faster, but it's still not an easy decision to be made. So hopefully, I've been able to answer that question for you. And my hope is that if you are worried, if you have any questions, concerns, just come into the office, visit us on my website, post questions here, and I'll be glad to put your mind at ease. Good luck on making these tough decisions with you and your doctor. And I'm sure that whatever decision that you both decide on is going to be the right one for you. And don't don't necessarily think that this is going to be the end of things, because I promise you, once you heal this up, you'll get back to a more normal life. And if you want to talk or call, we're open to listen to you. And if you want to post some comments to people who are going through this, maybe you've already gone through this. I've had patients who, for instance, have had below knee amputations and they've resisted it for months and months. And then after they had it done, we talk again a few months later and they tell me, gosh, doc, I wish I had listened and had done the amputation, weeks or months before. Most patients end up feeling like this. And you just need somebody to talk to that has gone through it. And the only way that hopefully, if you've gone through this, please post so that way other people can read and relate, and that really helps just to have that human connection. So good luck in your decision making, and I wish you the best. Let me know if there's anything else we can do to help. Thank you.